Hello, my name is Dr. Salsitz. I'm an addiction medicine specialist. I work at Mount Sinai Beth Israel in New York City, and I'm here attending the Pain Care for Primary Care Conference in Orlando, Florida. And I would like to do 3 points in 3 minutes on the topic of chronic opioids, chronic pain. The CDC, the Center for Disease Control, published guidelines for the treatment of chronic pain, and they were published in March 2016, and they're readily available on the internet. And the first point that they made, their first recommendation, they made 12 total recommendations, was that you begin treatment for chronic pain with non-pharmacotherapy. And you use modalities such as physical therapy, mindfulness, massage therapy, acupuncture, etc., all of which are evidence-based. And that would be the first option that would be used. If that was not effective, then the second option would be pharmacotherapy, but not opioid pharmacotherapy. So this would include the antidepressants, the anti-epileptics, local treatments such as a lidocaine patch or capsaicin. And then if that modality wasn't effective, then the third modality or the third option would be the opioids. But again, that would be a very deliberate decision. It would be considered only a trial. And if you did go with the third option of opioid pharmacotherapy, the CDC recommends that you always begin with immediate release opioid and not an extended release opioid. And the other recommendations include different ways that you can monitor patients as they continue on opioid therapy. And monitoring is very important. So of course you have to assess the patient at each visit, ask them how their analgesia level is, but particularly focus on function. How are they doing at home, at work, and try to verify functional status with reports from significant others. And the key features of monitoring include doing random urine drug tests, with which you will have to become familiar if you're currently not familiar with that, and also checking your state prescription drug monitoring programs. All states have prescription drug monitoring programs. In some states, it's mandatory to register and check each time you prescribe a controlled substance. In other states, it's not. But it provides valuable information on people who may be going to other prescribers, not only to get opioids, but to get medications that might be contraindicated, such as benzodiazepines. It has also recently been shown that the prescription drug monitoring programs decrease opioid overdose deaths.